this topic. And let me go ahead and share my screen to make sure that you can see the presentation. All right, there we go. Okay, thank you so much, Tony, for the wonderful introduction. We've known each other, like you said, for 25 years, and you've been a wonderful friend. And I just really appreciate you giving me the opportunity to present tonight. So tonight's objectives, what we're going to cover today, include learning about different strategies on how to use interpreters and interact with patients with limited English proficiency. So hopefully after the end of tonight's presentation, you will feel more comfortable in communicating with this population. Responsibilities as a healthcare provider for language assistance. We will cover a few basics on this topic. And then again, the different strategies on how to work with interpreters. We're going to go into more detail on that. So I am originally from Eastern Europe. I've lived in St. Louis for about 25 years, or actually more than 25 years, about 28 years. And I came to this country as an immigrant. So St. Louis became my home. I've lived here longer than I've lived in Europe, and I love my new home, and I love this country. I've had situations in my life where I didn't always have a home. And so I wanted to tell you a little bit about that. So when I was 11 years old, I escaped with my parents from communist Czechoslovakia to Vienna, Austria. So we were refugees. We lived in a refugee camp that was a concentrated area in the outskirts of Vienna, of buildings that housed refugees from mostly from the Eastern European bloc countries. When we came to Austria, we did not know the language. We were dependent on the kindness of other people and the generosity of the Austrian government and refugee agencies. We stayed in Austria for about a year while we waited to really receive political asylum to enter Canada under a refugee program. So there were two times in my life where I was in a situation where I didn't have a voice. I could not speak the language and I didn't understand the language. So it was kind of like not being able to hear. The first time was in Austria. The second time was when I arrived to Canada, where, of course, I didn't speak the language either. So if you ever want to try it at home with somebody, you want to see what it's like to be a refugee or immigrant who doesn't speak the language, just insert some earplugs into your ears and then don't speak and try and listen to them explain how their day was, and you will know what it feels like. So I'm so excited that I can speak with you tonight about how to communicate with those individuals who don't have a voice. In St. Louis here, we are very fortunate to have one of the 10 VOLAG organizations in the United States. VOLAG is short for Voluntary Resettlement Agency. And these are agencies that are recognized by the US government that have collaborative cooperative agreements. And these agencies resettle refugees that come from countries such as Afghanistan, or now we have a lot of refugees that come from Ukraine. So we are very fortunate to have this organization here because that makes our area very diverse. And I shared with you an image here of our clinic. This is where I work in St. Louis. We have about 100 dental chairs, and we're situated in the very center of the city. And we see about 5,000 patients who don't speak English. These patients speak 48 different languages. So we have the pleasure of serving these individuals, providing dental care. We provide interpretation services, and I lead a project that develops printed materials in different languages. So one of the first things I would like you to learn is the differences between refugees, asylees, immigrants, and migrants. So migrant is a person who moves from country to country for any number of reasons. An immigrant is somebody who moves to this country to stay, and it's either a legal immigrant, that somebody who establishes permanent residency, or illegal immigrant. There are also other categories of foreign-born individuals who fall under the category of the refugee or asylum seeker. So both of these populations seek protection from persecution. It could be religious, political beliefs, war, any of these reasons that drive the refugees to leave. So they're persecuted politically, for their beliefs, or they are escaping war. Now, refugees apply from outside of the US for a asylum, whereas asylum seekers apply from within. So that means that, let's say somebody came here to the US as a student, international student. And then while they were here in the US, a war broke out in their country, and now it's not safe for them to return. So at that point, they would become asylum seeker. Now, I just wanted to show you what kind of diversity we have here in Missouri. So the first section here shows you the original countries of the foreign-born that live in Missouri. And then the second part of the slide shows the primary languages of new arrivals just between October 2022 and September 2023. um, these individuals, when they arrive to the United States, face a number of barriers. The language, of course, is the greatest. Um, there is stress also when they come, because they're coming to a new society, new culture. There is stress from their environment that they were in. Many of these refugees were in refugee camps, and before that, they have gone through horrific experiences, let's say if they lived through war. Um, when we encounter these individuals and we are trying to communicate with them, nonverbal communication works to a certain extent. We have to also look at our stereotypes and preconceptions. We look at our stereotypes and then theirs as well, and we consider those and we try to overcome those and be open. So when the native language support is not possible or is not available, what kind of strategies can we use to improve communication? Well, we have to use controlled language. That means that we cannot use long, complicated sentences. We want to be brief, use very slow pace, use as many pictures, contextual clues, and relia as possible. Use effective body language. Be careful with writing. A lot of cultures use different alphabets, and when you write something down, they really cannot read what you're writing down. Avoid using pronouns. In many cultures, pronouns are differently used than in our culture. So avoid using pronouns as much as possible. Also, when you're using cognates, it's sometimes helpful because different words, or one word in different languages means similar thing. So using cognates sometimes is possible. Now be careful with idioms and idiomatic phrases. So idiomatic phrase like cut it out or it's raining cats and dogs. The individual, if they understand those words, will take those words literally. So be careful with using idioms or idiomatic phrases. And then when you're communicating with your patient, make sure that you don't just take yes for an answer. So, their knowledge of English can be very limited and they can reply yes or no, but they may not understand the content or the idea that you were trying to pass along to them. So try and ask open-ended questions. If we think about patient education, have them demonstrate back to you what you were trying to teach them. Use models, for example, to teach brushing and flossing, and then, hand the model to them, give them the brush, the floss, they will know what you want them to do. If you're doing hands-on demonstration with a mirror, give them the mirror to watch you show them, and then take the mirror from them, give them the floss, the brush, and have them show you back the technique. So have them demonstrate their understanding. So using plain language, I have one example here for communicating with someone who may not understand very well English, and we're trying to explain to them that there, is an option for them to quit smoking, and educate them on the benefits of quitting smoking. So, at the end of the conversation, you will want to ask them if they are ready to quit. So these are the two different ways you can ask them, right? So the first phrase here, are you ready to quit? Contact us so you can get a personalized quit plan, which includes a counseling session and a quit kit. You can also get names of classes and support groups in your area. This is, a lengthy way of saying, call us and we'll help you make your plan. Okay. Now, there is a great website here. It's a good reference that you can use to find similar tips and helpful hints on how to use plain language. I wanted to dive a little bit about the demographics of this population. So this data is from US Census Bureau 2019 American Community Survey. We had at that point over 41 million Spanish speakers alone. There were 349 other languages spoken in the US. The most common is Spanish. The next is Chinese, Tagalog, then Vietnamese and Arabic. But there are so many more languages spoken, and I think it really differs from region to region what concentration of that language is spoken in the society. Here in St. Louis, in our clinic, out of the 5,000 individuals who speak other language than English, about 2,500 speak Spanish. We also have a lot of Arabic speakers. Actually, German is very common here in Missouri. It's more in the center of Missouri where we have our Amish community. So not as much as in St. Louis, but it really depends on where you live. The demographics of the foreign-born will be different in different parts of the US. Now, according to the Healthy People 2030 report, patients with limited English proficiency are at low access risk for low access to health services due to not understanding the information we are trying to give them. And this negatively affects patient-provider communication, healthcare access, and health outcomes. When we encounter patients in our offices and clinics, we have the responsibility of providing as much language assistance as possible. You may encounter working with translators and or interpreters. In our clinic here, we usually encounter interpreters. We use video interpretation or on-call interpretation. Translators are often hired to translate written materials. We have a team in our school here that handles translations. Now, I want you to know the difference between these two individuals. A translator will only focus on translating written text. So converting from one language to another in a written form, a message, versus interpreters who only interpret spoken or sign language. So when you're talking about translators and interpreters, it's important to remember the difference between those two. Now, why don't we want to use family members as interpreters? There are various reasons. Most of the time, family members are not competent at interpreting. So it's not enough to be fluent in the language. There are different guidelines and rules that need to be followed. For example, the interpreter has to interpret word for word for what is being said. Many times, family members or friends will have side conversations. They may not know the terminology. They may not interpret everything that's being said. Now, there may be also conflicts of interest in regards to confidentiality and privacy. For example, a parent may not want to have, share with their children certain medical issues that they're experiencing. Also, you may want to keep in mind that, violence, domestic violence may be at play here. For example, if there's something going on with the wife and husband, there may be an issue with the husband not allowing the wife to really reveal on what's going on. Okay. Um, then at that point, if the individual still wants to use ad hoc interpreter, we do recommend here professional interpreters, but if they still want to use ad hoc interpreter, even though we inform them of the disadvantages of using ad hoc interpreter, we need to record their wishes in the chart and allow the ad hoc interpreter to interpret, while keeping in mind that the individual may still change their mind. So when it comes to a point in the appointment that the individual is uncomfortable, or we recognize an issue with the interpretation, the individual can still change their mind. This is a handout that will be available to you. These are guidelines that are based on recommendations from the U.S. Department of Health and Human Services and the National Council of Interpreting in Healthcare that you can follow when you're working with interpreters. There are things that you can do prior to the appointment, and that is verifying the language preference of the patient. Now, we have a system in our school here. We have a way of alerting the provider which language the patient prefers. And the first time we ask the patient for their language preference is when they're completing their health history. So we have an area on the health history that asks their language preference, and then we record that in our computer. So prior to the appointment, it's important for you to check to make sure that you know which language the patient prefers. Then select the mode for interpretation. So here in our clinic, we use video conferencing. There could also be a phone conferencing method that you will use, or in person. Now, professionally trained interpreters are usually competent at interpreting. However, they may not know terminology, medical and dental terminology. So it's always good to have a session, if possible, before the appointment to go over what type of appointment it will be, and then verify that they're comfortable, interpreting dental and medical terminology. When you are setting up the operatory and seating arrangements for interpretation, make sure that the seating promotes eye contact between the patient and you. It should be in a triangular formation, the seating arrangement. So, the patient will be in their chair, you will be next to the patient while the interpreter is across from you, maybe sitting beside the patient, so that you have direct contact with the patient, eye-to-eye contact. And as you're speaking, you will be directly looking at the patient. It is important also for telephone conferencing to make sure that you have quality connection. Okay. Now, during the appointment, when the patient comes in, you will introduce yourself and have others, like the interpreter, introduce themselves. Then you will make a note of the name of the interpreter for your records. As you are conversing with the patient, please use first person and ask the interpreter to do the same. As I said before, you want to speak directly to the patient and maintain eye contact. And use simple language whenever possible and avoid medical jargon. Remember that Health literacy and oral health literacy is very common among the population. Only about 50% of patients understand medical and dental terminology or medical dental instructions. So interpreters may also have low oral health and health literacy. So keep that in mind when you're selecting the phrases that you use in the communication. Remember that patients may also understand some English. So if you have any side comments, remember that the patient may understand what you're saying, okay? Observe your patient's nonverbal communication and speak clearly. Do not raise your voice. Many times I see sometimes in the clinic, if the students are talking to the patient, the student may know some Spanish, they raise their voice, and that doesn't make the patient understand you better. Just make sure that you keep your voice down. Pause often and allow the interpreter to interpret, especially before moving to another topic or idea. So I would say maybe 2, 3 sentences, and then I will stop and let the interpreter interpret, and then I will continue. Now, sometimes interpreters may not understand, like I mentioned, dental terminology. And so be sure to tell them maybe before the appointment that it's okay for them to ask open-ended questions for clarification. Okay, so the way that works is as you are speaking to the patient, the interpreter will interpret word for word what you said. If there is a need for clarification, the interpreter will say, excuse me, the interpreter would like to ask several questions for clarification. Then you will have a side conversation with the interpreter to clarify whatever needs to be clarified, and then the appointment will continue. The communication will continue. That includes the patient. Now, if you feel like the interpreter is having side conversation with the patient, then you need to, at some point, intervene and ask the interpreter whether this is a appointment that maybe is continuation of previous appointment. So they're kind of following up. Just make sure that they know that the accurate information needs to be passed between you and the patient. So anything on the side, I would question. And then, like I mentioned before, to verify patient understanding, use the teach back do method. Now, after the appointment is over, you want to document in your record the use of an interpreter. If the interpreter went briefly over any written documents, you want to document that the interpreter provided site translation of a document. And then you want to also put their date and their name down on the form to make sure that we know that that document was site translated. Now, if the patient declines language assistance, ideally you would want to have a form stating that the language was available to them, but that they declined the offer. Okay, this form must be available in their primary language. Okay, if they are unable to read, then there should be a way of them to have somebody read it to them. Okay. All right. So as a summary of what to do as an organization or an office or a clinic, these are the different ways where you can make it more welcoming for foreign language speakers to come to you and get treatment in your office. So you want to post taglines in top 15 languages. I would start with maybe the top 2 languages, top 3, and then add on to it as you develop your language assistance plan. You may want to post a sign with individuals' rights to language assistance. So there are some organizations like clinics, hospitals, and schools that are supported financially by the federal government, and those entities are mandated to provide language assistance free of charge. So some of these guidelines, pertain to them. Even if you don't work for federally qualified healthcare center, for example, I would say try and do your best in following some of these guidelines. Have your forms translated. So your forms that you're using in your office, like health history, consent form, I would have those translated to the top 3 languages to have those available for your patients. And then over time, you can increase the number of languages. Now, if you have qualified staff who is very fluent in language, the use of qualified staff is permitted. However, they should probably go through some training. You can establish a language access protocol in your clinic and have a training program, minimum training program that they should undergo, which includes interpreting medical language, also using ethics in medical and dental interpretation. And that program can be available to anybody who you think you will be able to interpret and is willing to play that role. Be aware of certain certification requirements. So for example, if you have somebody who uses sign language, you are obligated to provide American Sign Language interpreter. These individuals have to be certified and they have to have continuing education credits every year that they maintain, and that will satisfy their licensure requirements. Also, translators of legal documents, oftentimes they need to have certification, and also interpreters that work in court proceedings need to have specific certification. I would recommend that each office, each clinic develops and maintains language assistance plan. Now the don'ts, again, some of these only apply to clinics that are mandated to follow protocols and rules and laws and guidelines from the government. Those entities are not allowed to ask patients to provide own interpreter. They have to provide interpreter free of charge. But try not to rely on accompanying adults or children for interpretation, especially children. When I was 11 years old and we were refugees, when we moved to Canada, I learned English faster than my parents, but my English still wasn't very good. But I was the only one that was available to interpret. It was very hard for me as a child because I didn't understand any of the medical language. I did the best that I could, but I know that my interpretation was not very good. So try to not to put the child in that position. There are exceptions. For example, if there is an emergency, make sure to always document who provided interpretation in your chart, in the patient chart. Do not rely on technology for accurate interpretation or translation of vital documents. So I know we all use, Google Translate, especially if there's nothing else we don't have any other way of interpreting or translating materials, but just know that research shows that technology has limitations. One of the articles I recall reading was on Google Translate, and I believe that the highest accuracy that was measured was about 80%. So when it comes to medical and dental documents or talking about treatment planning, talking about conditions, it's very important that we have accurate interpretation and translation. Also, don't assume that because a patient can speak some English, that they don't need an interpreter. If the patient comes in and you ask them, how are you doing? And they say fine, and they can understand open and close when you're asking them to open their mouth or close, that doesn't mean that they will understand, more complex conversation about their dental condition or about the treatment plan, or that they will understand a consent form. So this is just an example of what a note in the chart would look like that is documenting the use of, interpreter. So on the left side here, it's the interpreter interpreted from the patient what they were saying, what their concern was. In this case, you can see why having a family member, for example, the son of this woman, provide interpretation, right? In your notes, you also want to include the date, the language spoken, name and qualification of the interpreter, names of everyone that participated in the discussion, Then if you were using a professional interpreter and you're working for, federally qualified healthcare center that is funded by the government, you want to make sure that you put in your note that there was that we used a professional interpreter and then that there was no fee charged. If the patient insists on ad hoc interpreter, for example, a family member or friend, after you explain the disadvantages of using ad hoc interpreter, then you just want to document that in the chart. And then like here on the left side, we want to specify the complaint and write in quotes, the complaint and then the name of the interpreter. So just a couple of resources for you here. And at this point, I will take questions. Thank you very much for your attention. I hope this was helpful.
Thank you so much, Ramona. I appreciate you sharing very timely information. I know that we are always trying to look for ways to learn new things and to enhance our care for our patients. So if there are any questions, let's see. In the chat.
Sharing. Hold on, Jill, let me stop sharing. There we go.
Sure. In the chat, Laura says, do you have recommendations on where to find interpreters?
Okay, so there are agencies that are, online. So I know we use global interpreting, but there are many more agencies across the United States that you can create account with, and then they are usually available whenever needed. And we use our monitors in our operatories, and we also have iPads that can connect to the interpretation service. Now, some of the VOLAG organizations, like the International Institute of St. Louis, they have also a department for interpretation and translation. There are, numerous agencies I know across the U.S. Good question.
What would be like a national, do you have like a list of resources for people that I can forward?
Not at this point. I mean, I can do some research online, of agencies. All you would have to do is just put in, interpretation agency, and it'll come up with different sources.
Okay. Let's see here. Looks like Ruth, not sure about the last name. Are there any ALS interpreters connections for dentistry?
Mm-hmm. This is a really good question. So RID, the Registry for Interpreters for the Deaf and Hard of Hearing, I believe that's what it's short for, RID. I am certified through them to provide training for ASL interpreters of dental terminology, and I know that they have a list of ASL interpreters.
Thank you.
Mm-hmm.
Let's see here. Jeffrey, do you have any statistics on real life experience where a male provider should step aside for a female provider with certain languages, cultures, religions?
This is a very good question, and I am working on some presentations on this topic, the cultural aspect of, males versus females providing dental care. In our clinic here, we had a few cases where a female provider was requested. So I think that when it becomes matter of importance and to the patient, I believe that they will voice their concern. We've had a few times where a male, person, somebody from their family, either their husband or, father or son, would come with them, accompany them. And I think that would make them feel more comfortable. But this is a very good topic and something that is next on my list to really dive into and put together some courses on that. And I was even thinking about writing a book. I can't even say it now because I don't have time to write a book, but it's on my to-do list. Very good question. Thank you.
Wonderful. Thank you, Jeffrey. Amanda says, isn't it against the law to turn away a patient or send them elsewhere because they need a translator?
I think it would be against the law. I don't think that I think they could definitely go and complain about that, but I know that only entities that are funded by government are mandated, absolutely mandated to provide the language assistance. I don't think it should be allowed, and I would think it's against the law to turn patient away for that reason. To turn a patient away for any reason, right? We're obligated to serve our patients who are in need. But I don't know the specifics on that. So also, just to get back to the previous question, search out organizations in your area that serve these communities, okay? Like the International Institute of St. Louis, they have client representatives, numerous client representatives that work specifically with those groups of people. And what a great resource for us that is. I think if you would reach out to them and want to find out more about cultural barriers, and maybe providing dental care, they would be more than happy to give you the information and work with you.
Thank you.
Mm-hmm.
All right. Are there any more questions before I announce the winner? Okay. Well, thank you everyone for your time. Thank you, Dr. Muller, for just your
You.
expertise and your details. And I know you've done a lot of research with this, and it's a passion of yours. So I appreciate you bringing it to light for the dental community. And I appreciate you being one of our very prestigious speakers for Aspen Dental. So thank you so much. I put names in a spinner. So I am going to spin now and see everyone's here. Jeffrey McMinn is the winner.
Yay, congratulations.
So congratulations, Jeffrey. I will email you if you've registered. I think I did see your name in the registration. I will email you tonight your $100 gift card to Amazon. So let's see here. Congratulations. And thank you, Dr. Romana. And
Thank you
thank
very
you all
much.
for,
And thank you
yeah.
so much for having me. And please reach out to me. My email again is rmuller@atsu.edu if you have any more questions for me.
All right. Well, thank you so much.
Thank you.
And I will give you all back the rest of your evening. Thank you for joining us tonight.
Have a good evening. Thank you.
Bye-bye.